every year, 20th of March, is a day that has been designated to celebrate the World Oral Health Day. And last year, this year, and by the grace of God, next year, the theme has been set to be proud of your mouth. How proud are you proud of your mouth? Okay. Well, I'll be discussing everything about oral health this morning. We know that oral health, the health of everything that has to do with your mouth. And when we talk about your mouth, we talk about your teeth, your gum, and your tongue. We'll be talking about everything, all of this morning, and many more with two professionals in the studio. In the studio with me this morning, I have Dr. Wemambu John. He is the Secretary, Nigerian Dental Association, Lagos Zone. And also with him, I have Dr. Oluwole Olusanya. He is the Chairman, Nigerian Dental Association, Lagos Zone. What really is oral health?
Oral health is a state of well-being of everything that concerns the mouth and its supporting structures. But we can extend this to the whole body as well. The mouth is the gateway into the body, and therefore anything that affects the mouth goes a long way into passing to the rest of the body. So oral health is the state of well-being of our mouth and the body as a whole. Yes, we can say that.
So why is it so important? We could have talked about why should a day be designated for oral health?
Okay, the International Dental Federation looked at it and said, okay, let's look for a particular day that would empower the people, empower the world to take particular notes and particular charge of their oral health so as to be able to reduce the burden of oral diseases. And in so doing, of course, if you reduce the burden of oral diseases, you improve the economy of nations, and you also inadvertently improve the well-being.
So tell me, what are those things? Because I know that Nigerians, most especially, there are some things we do ignorantly, and these things could be dangerous to the oral health of individuals. I want to believe there are some common things we do that could be dangerous to our health.
Well, commonly, our habits, eating habits, snacking, taking lots of refined sugar, those are the things that are dangerous and expensive, as if we look at it. Eating sweets, chocolates, candy, and all those things that actually spoil our teeth. They, if we're able to control the level at which those things are consumed by the populace, we will have a healthier nation and a healthier people.
So what do you mean by control? Do you mean we shouldn't take it? Do you mean we should take it minimal? Or there are things we ought to do? Maybe we brush our teeth or whatever, maybe after taking it or something.
Okay, so first of all, we say yes, control is the word.
Okay.
I mean, I'm not going to take any candy away from any child. But what we say is that there has to be controls. You don't let a child have access to sweets as they would like. They will spoil their teeth. They will go through lots of pain. So what you do is you try and control the time they take sweet things closer to meal times in controlled quantity. Again, the important things we always tell our patients: one, brush your teeth morning and night, especially at night, last thing after all meals. Second, make sure that you use the fluoride toothpaste whenever you're going to brush your teeth, and a toothbrush of bristles that match your person. That is, we advise that most people should use medium bristles. People who have dental diseases that have started affecting their teeth and gum should use soft bristles.
I want to be speaking small English, They are talking about medium bristles. Me, I know toothbrush.
Okay, so hard, soft, medium.
Now you're
hard
talking.
is for smokers, medium is for you and I, and then soft are people with dental diseases. Yes, soft. They need to use soft. And then, of course, the fluoridated toothpaste endorsed by the Nigerian Dental Association. And then, most importantly, we say that you visit your dentist twice a year for checkup.
Whether I have problem or I don't have problem.
Yes,
I
when
should
you
visit
have,
me.
yes, because most times we're not aware of the problems we may have. So the earlier you see the dentist, the earlier you may be aware
Just
of.
like we do the general
Oh, yes,
medical
yes.
checkup. Okay, you have talked about the food that, the things we consume that could be dangerous, that could harm the mouth, the tooth and everything inside the mouth now. Are there, in the same manner, are there some specific meals that we can take that can improve our oral health? Dr.
Yes,
John?
definitely. But let me just add a bit to some of those very bad, not too good habits that you find out there aside the food. You know, you find people commonly use their teeth as a bottle openers. Very, very common out there. These are very dangerous habits. You could crack the tooth right
Instantly.
away. Now, for some of these artisans, you find some of them using their, like the seamstresses, you find them always having pins in their mouth. I mean, it's just like a regular. You find that pin. What that does, these are all things like that destroys the supporting tissues of the teeth. Then for our mechanics and you find them using their mouth to act as sunshine for fuel. Or even the rewires and the electricians, you find them using their teeth to cut all these wires. So there are lots of negative
Everyday
out there
habits.
every day that people get involved with without actually knowing the exact implication of this on the oral health. So lots of these habits could also they could endanger the oral health. Now back to those food we take.
That can improve the oral health.
Generally, if you do the basic things of brushing when you should,
Okay.
Knowing when to use your floss and not toothpick. Well, people use toothpick, yes. We are not totally against the use of toothpick, but you need to know how to actually use it. But you find people just dip in the stick and try to move it from one end of the tooth to the other end.
Okay.
That's a very bad habit. So when you do all the things you're supposed to do.
So how should we do that?
I
I realize that a lot of people do not know how to use a dental floss.
Yes.
So they are more comfortable with the toothpick.
Now, because the makers of dental floss and the dentists have looked at this and said, okay, yes, this is a problem. So dental floss comes in different brands now. Okay. You have the one that comes with the handle like a toothbrush. It just comes like a toothbrush. So that's easier for anybody to use. I mean, it's easy for people to just use, rather than the one that comes as a string that you have to be adept at it to be able to use that one of this that comes as a string. Yeah. So aside all this, the best way to use a toothpick is the pointed head. You just use it to tease whatever you want to tease out and not pass it through and through.
Okay.
That's passing it through and through. Aside the fact that you are destroying the support tissues, you find out that you are creating a gap. You are creating a movement there, because once you continue to do something persistently, it moves, it gives, something will give. So you keep using that toothpick there, you destroy the support tissues, you create a gap there. So when you do all this, or when you avoid all this, and you take healthy food, any healthy food,
like
the normal fruits we take, bananas. Now when you take things like apple, because the acidic content, and oranges or grape, because the acidic content is high, we advise you rinse out. Yeah, because what happens is you take these things, you have it increases the acidity of the oral cavity, and what happens is it encourages the bacteria to grow and cause harm and damage. Aside the fact that the acid in them could cause erosion and abrasion of the tooth substance itself. So we are not going to say there's any food that you should not eat. We're just going to say, yeah, you take normal healthy food, but you take necessary precautions.
Okay, Dr. Oluwole, you talked about brushing the teeth morning and evening.
Night.
Morning and night, after all the meals.
All the meals.
Most importantly, night.
Yes.
Are you saying that, because I took note of that, most importantly, night. Are you saying that I can do without brushing my teeth in the morning?
No. But what we're saying is that at night, when you go to rest and to sleep, we are not actively salivating.
Okay.
Because we do not require it to either talk, to eat, or any other thing. So the production of saliva reduces.
Okay.
During that period, we have bacteria in our mouth. The oral bacteria feed actively. And if we have not brushed at night, we still have food debris on and around our teeth. The product of their feeding is to produce an acid, which normally the saliva, which is alkaline in nature, would have mopped up. So acid-base, acid-alkaline reaction neutralizes it. But because we're not actively salivating, what happens is that the activity of the oral bacteria is more at that period, and we come down with what is called dental caries, the holes, the cavities we have in teeth, which go from holes to pain, and finally you end up in the dental clinic and you have to have your tooth pulled if care is not taken.
Okay,
so that's why the nighttime brushing is very important.
Okay, now we have, I've heard one or two people say that even, you Google some things at times and you see it on the internet that when you brush, you do not rinse off. How true is that?
Okay, so we don't say don't rinse off.
You're laughing. But I'm sure you have come across.
We've had that.
Being a professional, I know where that thought process is coming
Please
from.
educate us.
So we don't say don't rinse off. What we say is rinse lightly. So toothpaste has fluoride in it. The fluoride is supposed to make the teeth strong and protect the teeth from dental diseases. If you rinse off everything, where's the fluoride that's going to help the tooth remain strong?
Oh.
So light rinsing will keep at least a bit of the fluoride.
So you don't do the Googling?
No. It's not a battle.
Like my dad did those days.
In those days, it was a wrong perception. It's just a light rinse, so that a little bit of the fluoride still remains in place, and so it will keep the teeth strong and healthy. Yes.
Ah, that's good. You want have something to say about that?
That's why I was laughing. That's just it. You want to retain as much fluoride
in your
within
teeth,
the oral cavity as possible.
Yes.
Wow. Some of us over the time we have some herbal toothpaste, and they are all out there, and you find out it doesn't have fluoride. Some of them, a whole lot of the herbal toothpaste don't have fluoride. Are you saying that it's unhealthy?
Okay, so back in those days, and as still is, a lot of people still chew the stick, bako, as we say in Yoruba, the chewing stick. Oh yes, the chewing stick has a lot of probably ingredients in it that are very good for the teeth, the mouth, and the body.
The charcoal.
Well, I will not say much about charcoal because that's another matter entirely.
Entirely, okay.
Yes. But what you see is that most of those things have not been tested. Yes. And anything that is not tested, you do not know the side effects. In those days, when they brush until now, and with modernization, the time you chew the stick over a period of time, it becomes soft. And it's the soft that you use to actually
wash.
We live a very fast life in Lagos now. I'm very sure that people that chew their stick chew them in a few minutes, and they actually use the stick to damage their teeth. But that much said, it's not that the herbal toothpaste and the herbal components of toothpaste are bad. The issue is how many of the producers of this herbal toothpaste have chosen to allow what they have put in their product be subjected to testing. So the Nigerian Dental Association is the watchdog for dentistry in Nigeria. And so long as any herbal toothpaste has not been endorsed by us, we say it's a no-no. So
are you telling me that confidently, if I insist on making use of a herbal toothpaste and I see the endorsement of your association,
yes,
it's safe to use?
Very safe to use.
It contains fluoride.
It contains fluoride in the right quantity.
In the right quantity. Okay.
Yes.
There's also something I want to ask, and I know that is a problem of a lot of people. I want to talk about bad breath. Actually, there are some people, I have come across some people that have dealt with, I've been trying to deal with bad breath over and over and over and over again, and it seems as if there is no solution. What can you say about this?
Okay. Now, the issue of bad breath, we need to understand where it is actually coming from.
Okay.
Bad breath can be physiological, which most of us, as in when we say physiological, bad breath can be something that it's normal in everybody. You wake up in the morning, you find out that you have some form of bad breath because over the night you were not actively using your mouth. Maybe for those that fast for a long time, those that fast from food and drink, you fast for a long time, you find out that when you speak, you tend to have bad breath because the same reason as when you sleep. Now, so that's something that happens. With that, all you need to do is you rinse out, you brush out, it's gone. Now, bad breath could also be symptomatic of an underlying problem. You find those that have diabetes, when they speak at times, you find what we call ketone breath, like sugar breath from them. You find that ketone, you find a particular kind of breath. You find those that have liver and kidney diseases, when they speak, you can perceive some form of breath from them. Now, then you have the bad breath that is caused by oral diseases, like caries. You have a hole in the tooth that is decayed. You have bacteria constantly acting on it and bringing out this odor that you call bad breath. Now, so if you've been having bad breath and you've been seeking for a solution, the question to ask is, have you gone to the right place to seek solution? Because bad breath could be caused by a whole lot of factors. Now, for the ones that are caused by a hole in the teeth, or even destruction of the support structures of the teeth, which you also find in some diabetics, and that is easy. You get to a dental surgeon, you get to a dentist, he's able to look at it, treat the ones he could treat, and then refer you to the physician if need be. Now, also, bad breath could be caused as a result of accumulation of bacteria, what we call bacterial plaque. You find those stony
bacteria in the mouth?
Yes. Those bacteria in the mouth can coalesce together and form stony structures that you find attached to the roots of the teeth, that most times at times you flake off, it comes out like, oh, this is a hard structure. Those are actually bacteria that we say have calcified. Now, when you have lots of it in the mouth, it causes bad breath. And that's why when Dr. Olusanya said, at least you visit your dentist twice a year, it's to get those flaked off and clean, because no matter how much you brush, you can't get them off once they form. So you need a mechanical means of getting them off. So the issue of bad breath is a wide area. It depends on what is causing it. It depends on the cause for you to know the perfect solution to administer.
Just to add a little to what he has said, there are two instances which are very common. The first one is the common cold that we have. If you've ever been around people who have common cold, just the cold, they have a bit of breath from their mouth if you smell around them. And so we find out that respiratory conditions, diseases of the upper and lower respiratory system, we're able to, identify through the breath. People who have things like tuberculosis, this other one.
Diabetes?
He said diabetes. Bronchitis, from their sinusitis, from their breath. You're able to, yes, all those are infections. And then there's the last one, which is very important when it comes to bad breath, halitosis as we call it. It's called psychogenic halitosis, where you feel you have bad breath because yesterday you spoke to her and she turned away from you. You don't actually have it, but you feel you have it because of people's reaction to you.
Honestly, I want to go. I have so much to talk about with this issue of bad breath, but I know that I have to wind down this discussion because my director has been on my case, and I cannot wind down this discussion without talking about oral Health Day 2022, World Oral Health Day 2022. The theme is being proud of your mouth. Tell us, what as your association, Nigerian Dental Association, Lagos Zone, what did you people do? What is the significance, and what is the awareness that you people are bringing to the public in respect of this?
All right. As said before, World Oral Health Day was encapsulated. The idea was formulated by the World Dental Federation about 2013, thereabout. A day is chosen yearly to celebrate the dental profession, and of course, in doing that, we give back to the public. We do what we call oral awareness, oral hygiene
let's talk about
awareness.
what you did this year.
And oral health promotion. This year, we started off, of course, not just the day, around the day, prior to the day, we were on Traffic FM on Monday. We had a phone-in program where we tried to educate the public as much as possible on their oral hygiene. There was one on Saturday, past Saturday in Yoruba, done by one of our senior colleagues, Dr. Castano Babalola. On that Monday, the World Oral Health Day fell on a Sunday, and because that's not a working day and we wouldn't get maximum traction, on Monday, most clinics, most centers around
Dental
Lagos,
clinics,
they had awareness programs within the hospitals.
so
and
what are
they
you
went to the
telling us?
public.
What are you making us aware of?
We're telling you that you need to be proud of your mouth. You need to be proud of your smile.
How now?
And to do that, you need to, one, brush your teeth twice daily. Visit your dentist
Twice a
yearly
year.
for scaling and polishing, cleaning, and for general oral hygiene instructions. 3, you need to be careful what and when you eat, and all the other oral habits that my colleague spoke about.
Okay.
And so we went to town.
So those were basically the awareness that your
Yes.
association
All-
gave
and
to
then
the public at large.
To give back, we had discounted treatments done on that day.
I was not there.
You were not there. I'm sorry you missed.
I missed.
You missed. Free oral screening round all the general hospitals in Lagos State, and discounted treatments, I'm sure up to 50%. So people trooped in from Badagry to Ekpe, from Alimosho to Ikorodu.
Wow. Well done.
Yes. And so that's it. On Monday, we're going to be at Okwebi Grammar School. We're going to have an outreach to the school, have them, check them, screen them, and then as much as possible, give as many oral products to the students.
All right. I need to let you go now. But in 10 seconds, Lagos, Nigerian Dental Association, Lagos Zone, what is your responsibility in 10 seconds?
Well, our responsibility, like I say, is to bring that awareness of the totality of oral health diseases and its burden to the masses, and to bring it to the doorstep of the government so as to know the policies to put in place to make oral health affordable for most Nigerians.
So I can say that you are the middleman between the government and the people.
If you put it that way.
All right. What will you say to the public at large in 10 seconds?
Well, to the public, we're here for you. The NDA is the watchdog. We are the bona fide association that when it comes to anything dental in this country, we're there. So if you are at a loss, please contact us.
All right. It's been a pleasure to have these gentlemen in the studio with me this morning. Dr. Olusanya, thank you very much.
You're very welcome, Yinka.
And Dr. John, thank you for being our guest this morning.
My pleasure. Always my pleasure.
All right.